Someone just asked along here real quick, said, Doc, what about a rotator cuff? My husband's got problems. I think that's how I read that. With a rotator cuff thing, I'll go back in time.
Well, he goes on the disabled list.
Well, that's how it works, right? Isn't
Yeah.
that's the key to this thing here. There we go.
Tommy John surgery.
Suggestions on rotator cuff, constant pain going down the arm. Yeah, you got to figure out where it is. So the rotator cuff, what's misleading about it, when they teach this, really the doctors and things like that, it's 4 muscles, right? It's 4 muscles. They call it your sits muscles. It's not really 4. It's closer to 12. But the 4 muscles, like the supraspinatus, for example, has 2 separate divisions. Neurologically, they get their power from 2 different sources. They have 2 different nerves. They have 2 different functions. But their muscle as a whole, it's almost like when you buy chicken cutlets at the store. Sometimes you buy them in that saran wrap, and you can't tell there's 6 of them there. It looks like 3.
Right.
That's what this fascia does that wraps around these muscles. It binds them together. So when the muscles contract with 2 different power sources, they have one function. They pull at one function like that. So if you can learn to look at these individual pieces, you can turn it all back on. Now, the key to the shoulder girdle is that there's roughly 70 muscles between the neck, the anterior, and the back side of the shoulder. So it's not just the rotator cuff you're looking at, it's the whole thing. So in practice, when I see this all the time, frozen shoulders, rotator cuff stuff, Dr. Elamine, when he was in town, he used to refer patients over to me all the time to help rehab a rotator cuff for them before surgery or avoid it. And so what you would do with this is you look at the mechanical parts first. Make sure, the bony pieces are where they belong. Once you get that all lined up, then you go back and start we call it muscle memory reintegration. You restart these muscles. You get them to fire again. It's very much like a hairdryer. You know how you have the little buttons on it and you plug it in and nothing happens? And you're like, and you go to the plug and you hit those little buttons and all of a sudden, now it works. They're called GFI switches. These muscles have this same thing. They get this little switch that gets tripped when it gets overloaded. All you gotta do is go back and reset it. When you reset it, the muscle will engage immediately. You get enough of those to re-engage, it'll stabilize the shoulder, settle it all down, a little tiny bit of rehab, it'll all go away and you'll be in good shape.